now I quickly move on to the next talk. I am Dr. Subhranshu Sengupta, and I'll be speaking on research hypothesis, data collection, and database building.
Excuse me, Dr. Subhranshu. May I introduce you yourself?
Yes.
Dr. Subhranshu Sengupta is a FRCS Glasgow, and he is a PhD in ophthalmology and working as a senior consultant in Center for Sight, Kolkata, as a expert in medical retina, neuro-ophthalmology, phaco and refractive surgery, and he takes a keen interest in medical research. And now, Dr. Subhranshu, please.
Thank you for your kind words, sir. So, coming to the research hypothesis. A research hypothesis actually translates a research question into a prediction of expected outcomes. The research question itself identifies the variables or concepts under investigation and asks how the concepts might be related, and hypothesis is the predicted answer. So what are the essential elements of defining variables, whereas the outcome is of the dependent variable? A good research question should have finer characteristics. So it should be feasible, interesting, novel, ethical, and relevant. Now, looking at the research hypothesis, what are the characteristics of a good research hypothesis? There should be conceptual clarity, there should be objectivity, specificity, it should be relevant, consistent, it should be feasible and cost effective, and it should have profundity of effect on the research variables. So what could be the sources of hypothesis? Could be theoretical or conceptual frameworks, could be previous research, could be academic literature, and of course, could be real life experiences. What are the types of hypotheses? Simple hypothesis, wherein we are basically looking at two variables. Complex hypothesis, wherein a number of variables are involved. Hypothesis could be associative and causal. It could be directional. Like, for example, we might want to give a hypothesis which has a negative or a positive answer, or it could be a non-directional one. And of course, it could be a null hypothesis or research hypothesis. Research hypothesis, also referred to as the scientific hypothesis, are statements of expected relations between variables, whereas a null hypothesis is that there is no relationship between the dependent and the independent variables. And null hypothesis is basically referred to as the statistical hypothesis. Now, some researchers have criticized the concept of hypothesis. They say that there is no positive contribution. It may bias research, it may predetermine outcome. Some qualitative researchers also claim hypothesis should result from investigation and should not be pre-proposed. Now, coming to the next part, data. So it is the lowest unit of information. We can have quantitative data, we can have qualitative data, which we can quantify using things like Likert scale. It could be an ordinal data, or it could be a signal data, like, for example, an ECG tracing. Now, let us look at the story of the 6 blind men and the elephant. The one who touched the tail thought it's a rope, the one who touched the trunk thought it's a wall, and so on and so forth. Now, we might have a lot of data, but if we have not formed a proper database and analyzed them properly, then we would be left by just like these 6 blind men. So planning the data collection, we have to look at the objectives and the scope with respect to the research question and the hypothesis. We have to look at the sources of information, the quantitative expression, techniques of data collection, and the unit of collection. Now, just to give a pictorial representation. So basically, the data requirements, the information source, and the budget, they all determine, we have to, with the help of these, we have to determine the sources of data, then bring up a data collection design, and finally go ahead with the data acquisition plan. So if we have to look at the flow of thought process or flow of work process, so first and foremost, with the help of the research question and the hypothesis, we have to identify the types of data, the types of measurements and variables that are required. and the various instruments, skills, and methods that we may be using, of course, after ethical committee clearance. Then we can go in for a pilot testing, and with the help of the results of the pilot testing, we can either go back to the instruments and the methods, or if we are satisfied with the results of the pilot testing, then we can go ahead with the data collection forms and the operational procedures and subsequently implementation of the same. So the data collection sources could be internal sources, external sources. External sources could be primary data and secondary data. Primary data is the first-hand data, the merit being it has a higher degree of accuracy, but it is time-consuming and costlier. We can collect data, primary data using direct personal investigation or interviewing, indirect oral investigation with the help of case studies through measurements, experimentation, lab results, or investigations through observation. Secondary data is something which has already been collected by others it is available through journals, periodicals, publications, official records, etc. Well, it is secondary data is indeed a quicker way of collecting the data and cheaper, but then it has poorer accuracy, obviously. So the collecting the secondary data can go for the published secondary data, or you can go for unpublished data. From our point of view, when we are doing health research, the primary, secondary sources could be birth and death records. It could be medical records at our hospitals, the databases, and so on. Then comes the concept of metadata. It's the data about the data. That is the method of collection, the relationship of data to the events in the research protocol, etc. For example, if we have to look at intraocular pressure, when we are mentioning the intraocular pressure, we tend to mention the time of measurement and when the last anti-glaucoma medication was applied. So this is basically an example of temporal metadata. So we need to choose when to measure, qualitative. Then coming to the primary research methods and techniques. For primary research, for quantitative data, we can fall back on surveys, experiments, mechanical observation, and simulation. For observation could be a participant observation where the observer himself or herself is a part of the group that is observing. It could be a non-participant observation. It could be an uncontrolled observation in a natural setting or a controlled observation in a pre-arranged setting. The second is that of the interview. So it could be a structured or unstructured interview, focused interview with the help of focus group. It could be a clinical interview or a non-directive interview wherein we encourage the respondent to talk about the given topic with minimal direct questioning. Then we come to the popular questionnaire method. A questionnaire consists of a number of questions printed or typed in order on a form or set of forms. So it could be a multiple choice or closed questions, which are better. Open-ended questions are designed to permit a free response from the respondent. Gives the respondent considerable latitude in phrasing a reply. Effective questionnaire should be short, simple, have a logical sequences. Best provision for indications of uncertainty like no preference, etc. should be there. And finally, we come to the method of collecting primary data through schedules. So basically, schedules is essentially collecting data just like questionnaires, but then here an enumerator is involved who is specially appointed to fill the schedules in. So definitely it is more expensive than simple questionnaires, but then it elicits a lesser number of non-responses. Finally, getting your data ready. So once we have collected all the data, now we will have to put them together using a unique identifier. Better to assign a unique identifier, organize and keep all the forms which are the back source of all your data, like the questionnaires, the interviews and testimonials. Check for completeness and accuracy of the questionnaires and remove those that are incomplete or do not make sense. So nowadays we generally going for computerized recording of data, which is basically the data availability and the calculations are much more faster there, but then definitely hardware and software backup, cloud support, etc. would be required. Commonly used platforms nowadays where for storing data could be Excel spreadsheets. For database management, we most often end up using software like Microsoft Access, quantitative analysis softwares like SPSS, and for qualitative analysis, we could use software like EpiInfo, InVivo, etc. Like when I was collecting data for my PhD, I used these simple spreadsheets with all the variables and the unique identifier numbers. I would also store them in SPSS, which offers both a data view and a variable view. And of course, with all these data stored, the next part is analyzing the data, which would be taken up by Dr. Morekar. And I thank you for your kind attention.